Top story now at the bottom of the hour. Members of the Senate Finance Committee have voted down 2 additions to healthcare reform legislation calling for government-run insurance, the so-called public option. The current version of the committee's bill, though, mandates that everyone purchase some kind of coverage or face an eventual fine of $25,000 and up to a year in jail. Chief Washington correspondent Jim Angle takes a closer look.
There's only one little problem with the requirement everyone buy insurance. Some legal experts argue it is flatly unconstitutional.
The heart of this plan is an unprecedented imposition on individual liberty.
Why? The Constitution allows the federal government to regulate interstate commerce, but Rivkin argues the insurance requirement has nothing to do with that. It's just an attempt to dictate personal behavior.
Not connected with any economic activity. Not because they grow something, make something, compose something, merely because they live. And this is absolutely unprecedented.
Back in Prohibition, the federal government dictated personal behavior by making the consumption of alcohol illegal, but to do so, the nation had to pass a constitutional amendment. But healthcare reform depends on the individual mandate, in part because it needs the money and good health of younger people to fund the system and spread the risk.
When you're 25 and healthy, you think you're invincible. You think you're never going to get sick. You're never going to get into an accident.
And so young people don't buy insurance. But Kendall says if one gets into an accident and runs up huge medical bills, taxpayers foot the bill. He argues the Interstate Commerce Clause justifies the mandate because it regulates insurance and health care. But when the Clinton administration wanted an individual mandate in the 1990s, the nonpartisan Congressional Budget Office also called such a requirement unprecedented, saying the government has never required people to buy any good or service as a condition of lawful residence in the United States. The government does regulate other behaviors such as use of illicit drugs, so why not a mandate to buy health insurance? But if government can do that to protect taxpayers, why couldn't it force people to stop smoking or lose weight? The Congressional Research Service looked into the mandate question and concluded only that Congress may have that power, but called it the most challenging question, meaning the centerpiece of health care reform is still open to debate. In Washington, Jim Angle, Fox News.